Dr. Gongal is a public health veterinarian working as a regional advisor under Healthier Populations and Non-Communicable Diseases in WHO Regional Office for Southeast Asia. He has been one of the active members of the Regional Tripartite Coordination Group in the Asia Pacific region since 2010, which has helped to promote better understanding of intersectoral collaboration for addressing rabies, emerging zoonosis, food safety, and antimicrobial resistance. He has contributed in advocacy and promotion of operationalization of One Health in the Asia Pacific region and establishment of functional national codex committees in several Asian countries. He has been involved in developing regional strategy, guidelines, and policy papers for prevention and control of emerging infectious diseases, including zoonosis and food safety. So now I will request him to present his paper entitled Antimicrobial Resistance, Food Safety, and International Trade. Dr. Gongal, please.
Thank you very much. I am happy.
Excuse me, sir. Sir, excuse me, sir.
Yeah.
May I request Gyanendra sir to please announce the panel?
Now Dr. Brahmavat sir is finding difficulty to join. Once again he tried, but it is very difficult for him to join the webinar. So I would request Dr. Bilegavkar sir to be the co-chairman for this evaluation. Okay, sir.
Okay. And since time is running out, and I will request Dr. Gongal to restrict his presentation for 40 to 45 minutes, please.
Okay, thank you very much. So previous speakers, they have already highlighted about antimicrobial resistance, its public health importance, as well as it is a matter of food safety. And I will also try to give you another thought on international trade, how AMR is affecting international trade of livestock products, fisheries products, aquaculture products, and even honey. So I will give you a brief introduction, what is the problem and how we consider antimicrobial resistance as a food safety issue, and what is the pattern of using antibiotics in animal production and its impact on international trade, and what are the WHO initiative for containment of antimicrobial resistance and One Health. So we all know that Alexander Fleming, he discovered penicillin in 1929. And even at that time, he foresee the issue of resistance. It is not difficult to make microbes resistant to penicillin because it is part of evolution, and previous speaker highlighted about evolution of pathogen and resistance and so on. So this may happen because everyone can go to shop like for over-the-counter sale is there, and they can take antibiotics. And for example, if I have typhoid, because of limited financial situation, I will buy few tablets, and when fever subside, I will stop. So that means underdose. And even there are issue of non-lethal lethal quantities of drug that make them resistant. So even this person who invented penicillin, he foresee these kind of things while he was trying to deliver it keynote speech. So antibiotics, it is also known as like a bullet, are used in many settings, and people were thinking we'll get rid of infectious diseases because antibiotics work perfectly. And it has been used in clinical medicine at community level, animal husbandry, aquaculture, and horticulture. And same type of classes of antimicrobial resistant agents are used in different sectors. And any use will select for resistance. That means it exerts selection pressure. And that has been highlighted by previous speaker. And these resistant bacteria and resistant genes do not recognize geographical or ecologic border. For example, in 2008, this New Delhi metallo beta lactamase 1, Yendium 1, it was discovered in Sweden in a patient, a Swedish patient of Indian origin in 2008. And when there was surveillance of Yendium 1 in 2015, it was found that it is present in 70 countries. So that is the way we have to understand. And because of this migration and people are moving around the world, and 1 million people are on moving train, you see. And that's why this is the challenge we are facing. And here our concern is human, animal, and food. So antibiotics in animal feed remain poorly regulated. And the era of antibiotic growth promotion commenced in 1946 with the recognition of substantial growth response to the inclusion of streptomycin in the feed of chicken. And in 1950s, many antibiotics, they were used, and it was found that vancomycin resistance enterococci, it was cocci, it was found in human being, and it was related to use of avoparcin as a growth promoter in poultry production. Yes, resistance is a biological phenomenon, and nature try to preserve any infectious agent, and that is a natural pathway. And antibiotics are extensively used for treatment, prophylaxis, as well as growth promotion. And we have to understand that antibiotics are produced, used against specific pathogen. But we should also understand that antibiotics also kill innocent bystander bacteria, which are non-pathogen, because in our stomach and intestine, a lot of pathogen are there from mouth to anus. So, and it also transfer that resistant gene to non-pathogen. And the use of antibiotics also promotes antibiotic resistance in non-pathogens too. So that is what is happening. And overuse, underuse, misuse, all those contribute to resistance problem. And these non-pathogen may later pass their resistance gene onto pathogens. So in that way, this is happening. And we all know that many antibiotics are used, like colistin sulfate and some other antibiotics are used in poultry production and pig production. And animal consume 3 times as many antibiotics as human, because in the name of production, animal production, we are compromising food safety and public health. So that is the ground reality. And we have to feed so many people, and that's why we have to produce more. It is expensive to get vaccination and biosecurity measures. And in our setting, especially small farm holding, that is another challenge. We have to use antibiotics for animal production. And there is a impact of antimicrobial use on antimicrobial resistance across the sector. So either it is used in human or animal, it doesn't matter, but there is antimicrobial resistance in human as well as animal, and it may happen either way. So that we have to understand. So rational use of antibiotics in human as well as animal, that is necessary. And if we see the burden of why we are so much worried about EMR, because there was estimate of burden of antimicrobial resistance, and we can see evidence-based information. It was done in European Union, Thailand, and United States. And in Thailand, the population is 70 million and more than 38,000 deaths. When we see European Union and United States, it is less than that one, 500 million population and 300 million. And here we have only 70 million. And more than 3.2 million hospital days they have to spend. So because antibiotic becoming weak and weak. And as Dr. Ashok Kumar, he mentioned, right now 700,000 people are dying due to drug resistance problem. And by 2050, it is estimated that 10 million people worldwide will die due to antimicrobial resistance. And this is a real issue because anybody can die and you are helpless, or doctor is helpless because antibiotics, it is not working. And another important thing I want to highlight is that there are also challenges. If we invest in discovery of new antibiotics, it costs billions of dollars. And we know that it will misuse, abuse. And that's why I cannot return that money back for research. So that's why we are using derivatives, and we are not going to invest more on new antibiotics because of resistance problem. And use of antibiotics in animal or plant, it may result in resistance bacteria, and it is passed to human through food chain. And we have to understand that environment and all those things, there is a pressure on resistance. In India, if we see the Ministry of Health and Family Welfare, it decided that there is antibiotic bar on food producing animal. It happened in 2012, and withdrawal period and meal discard time, it was mentioned. But unless the Department of Animal Husbandry is involved, it is not going to be enforced. And that's why there was a policy disconnect. And it is important that the law enforcement agencies, particularly Department of Animal Husbandry, they must be involved in the process so that it can be implemented and it should not remain only in paper but in practice. And according to report by the Global Antibiotic Reporting Partnership, 40%, the amount of antibiotics sold in India increased 40% between 2005 and 2009, according to Yanke Ganguly. And by 2030, there is estimate that BRICS country will be using most of the antibiotics in animal production. And there are also limited regulation and lack of information on antimicrobial use in food animal that raise for domestic consumption. Yes, for international export, we are trying to follow the requirement, particularly in aquaculture. But what about domestic consumption? That is also another challenge in India. And what we have to do, reducing the amount of antibiotics used in agriculture and phasing out of non-therapeutic, non-human use of antibiotics in animals. That is the way forward, and we have long way to go. And tackling antimicrobial resistance from food safety perspective, our WHO European region, they produce a document, and that because Europe is in forefront for the minimum use of antibiotics from the very beginning. And when we use antibiotic in food animal, either for treatment, prevention, or growth promotion, definitely through food chain, we get that resistant gene in our body. And there is a need of increased awareness and policy guidance for containment of antimicrobial resistance from food safety perspective. And antibiotic use, definitely it is used in human health as well as animal health, but there are some issues, common issues that we have to understand. In human health sector, we go for self-medication. If I will go to doctor, I have to pay 2,000 rupee. So why should I go? And similarly, there was TV coverage in China. The poultry farmer, they did not want to consult with veterinarian because they have to pay money. So they will go to veterinary shop and they will buy antibiotics as a growth promoter. And in human health side, patient compliance, that is underdose or overdose that is happening. And in animal health side, withdrawal period, meal discard time. So if we use antibiotics, it doesn't mean that it is a problem, but we can minimize the resistance problem. Unfortunately, withdrawal period, meal discard time, we need a lot of awareness and education and partners cooperation from the private sector to follow these guidelines. And antibiotic sensitivity test, it is done in human health sector, but basically it is more for research, and in animal health sector, it is for companion animal. Over-the-counter sale, you can buy anytime, anywhere. So that is a problem both in veterinary sector and in human health. Life is valuable, so use of new and expensive drug. But in veterinary sector, it is guided by economics, so that play important role. And human health sector, life, duration of illness. If antibiotic is not effective, then duration of illness and hospital stay will be longer. In veterinary sector, it is trade, production, and food security. It is compromise, or there are issues which compel us to use antibiotics in animal production. In human health sector, there is counterfeit drugs. That is a major issue. But in veterinary sector, it is a minor issue, and it is cost factor. And when we talk about antimicrobial resistance international trade, we have to understand that importing country or trade block put food safety and quality requirement to exporting country, which may include livestock and poultry products, fish, seafood, and honey. Because antibiotics are used for control of diseases in those animals and insects. And what are the critical to make decision for import by importing country, particularly USA, European Union, and Japan. So first, they want evaluation of national veterinary services, legal framework, enforcement, and all those things. In India, performance of veterinary services was done by OIE in 2018. And they also do risk assessment. What is the risk of importing antimicrobial resistant gene? So they will see regulatory framework, whether the poultry farmer, they have to get prescription from veterinarian to use it or not. And what about the withdrawal period and milk discard time, annual surveillance system, what is the disease pattern and how it is controlled, and laboratory capacity for investigation, detection, and validation, residue monitoring system, it is for veterinary drug, pesticide, as well as mycotoxin, aflatoxin, veterinary drug supply, sale, and use in feed. So these are the important issue they try to see. And last but not least, farming practice, biosecurity, vaccination, and management. Now, there is a big concern in international trade, because European Union, they have regulation 2019-6, in particular Article 118, aimed at implementing the global consensus on addressing the global health risk of AMR by preventing the use of medically important antimicrobials for growth promotion purposes. So it was discussed during Sanitary Phytosanitary Committee under WTO. And now European Union is saying exporting country of animal products comply with EU production standards that will effective from 20th January 2022. So this is a clear message that they are going to ban import of livestock products from those countries where antibiotic is not regulated, where there is no residue monitoring system, where there is no risk management approaches. And there is also revision of code of practice in Codex Task Force on Intergovernmental Task Force on Antimicrobial Resistance. So Republic of Korea, they are hosting this meeting, and they are going to have two things. One is code of practice they want to change, and secondly, guideline for integrated surveillance of antimicrobial resistance they are going to adopt, which was developed by WHO. And there is also another trend that use of whole genomic sequencing in international trade of animal products. That is going to happen in next 5 to 10 years time. So that's why we have to understand that we must take action. And just let us see what is happening in Europe. Sale of food producing this species in microgram population corrected unit of the various veterinary antimicrobial classes for 31 European countries in 2017. Here we can see that penicillin and tetracycline, they are extensively used among antimicrobial substances. It constitutes 57% of total. And we can see very clearly Scandinavian countries like Sweden, Norway, Iceland, and Finland, they are able to minimize the use of antibiotics in food animal, whereas other countries, they are still struggling. But there is a requirement that they cannot use medically important antibiotics for animal production. And what about the Netherlands? Reduction in amount of antibiotics used in agriculture livestock in the Netherlands from 2006 to 2019. Here we see this yellow poultry production, the use of antibiotics is decreasing, and it is more in pigs as well as cattle. But whereas in Turkey, there is a real challenge. So this is the scenario that it is possible to reduce the amount of antibiotic in animal production. That we should try to do ourselves. And as previous speaker has already mentioned, that consumer concern we cannot ignore. And there are multinational companies. They are trying to improve their scorecard, restaurant antibiotic use policies and practices. There are certain criteria to determine where they are. And even in Germany, when I was there, uh, there were antibiotic contaminated product. The government declared it is unfit for human consumption. And those meat, chicken and meat, were used for production of pet food. And there were demonstration in the supermarket that we cannot uh, use this contaminated antibiotic contaminated product for pet animals, because they are our children, you see. So in that way, there is a awareness and education at consumer level, at this community level. And particularly in poultry sector, that is more active participation of industry to commit in reduction of antibiotic use. But in pig and cattle production and turkey, it is less. And there is also commitment, fully meat and partially and in no place. So that will determine A, B, C, D, or F. And in Canada, when I was there, I found that there is advertisement that they want to draw attention of consumer that we are using vegetarian diet for poultry, and we do not use hormone, we do not use antibiotics or steroid. So these are the things it is happening in Europe and America and Japan. That's why they have to address this consumer concern. Now, why we are trying to make it international issue? There is a global public health challenge, and we all know that AMR is going to be the biggest public health threat in this century. And AMR, it is a trans-border issue and needs global affirmation for containment. And it is started in 2014. There was World Health Assembly resolution that outline the need to develop global action plan on AMR, because we all are working for human being. So that's why it was discussed in World Health Assembly. And in 2015, it was decided that there should be global action plan to develop national action plan on use of antimicrobial in human being as well as in animals. So it was adopted by OIE and FAO. And in 2016, there was UN General Assembly that saw global commitment, and we are working with member states to develop national action plan on containment of AMR, which was also mentioned by Dr. Ashok Kumar. And in that way, we are trying to reduce the burden of antimicrobial resistance. So what WHO is doing, antimicrobial resistance is one of the 19 technical areas under joint external evaluation. It is done under International Health Regulation 2005, and it is also part of global health security. And there is a global action plan for AMR as guiding document and supporting document for development of national action plan. And we have advisory group on integrated surveillance of antimicrobial resistance, EGISAR, and extended spectrum of beta-lactamase E. coli tricycle project, which is also going to be launched in India, and tripartite coordination. There is One Health initiative at global as well as regional level. In regional level, FAO, OIE, and WHO, we have One Health coordination group, and we have considered 4 priority area. One is zoonosis, another is food safety, EMR, and rabies. So that's why we are working together. And World Health Assembly resolution on food safety, and we are also working with Codex in Intergovernmental Task Force on AMR to revise code of practice and develop a guideline for integrated surveillance of antimicrobial resistance. So global action plan strategic objectives is was also highlighted during inaugural session. Improve awareness and understanding of AMR through our education training, strengthen knowledge and evidence base through surveillance and research. So that's why WHO is basically involved in this process. Reduce the incidence of infection through effective hygiene and infection prevention and control measures. In veterinary side, it is vaccination and biosecurity. Optimize the use of antimicrobial medicine in human as well as animal health. That also I will try to highlight. We have critically important antibiotics, that is CIA, and ensure sustainable investment through research and development. So these are the 5 strategic pillar of global action plan, and we are trying to help our member states. So WHO Advisory Group on Integrated Surveillance of Antimicrobial Resistance, it was established in 2008 and re-established in 2014. It has mandate to minimize the public impact of antimicrobial resistance associated with the use of antimicrobial substances in food animals. And there are 36 EMR experts that is multidisciplinary and multidimensional, microbiologists, veterinarian, physician, and epidemiologists. They are part of EGISAR, and the term of reference is to support global action plan implementation. What are the basic objectives to support implementation of global action plan on antimicrobial resistance? Containment of AMR from the food chain, capacity building for integrated surveillance of antimicrobial resistance, monitoring of antimicrobial use, particularly in veterinary sector, WHO list of critically important antimicrobials for human medicine that should not be used for animals, and FAO, OI, WHO tripartite activities and Codex Alimentarius activities on EMR. So addressing EMR using One Health approach, that is, we are going to build on the existing, so a multidisciplinary group of experts, and we have well-established tripartite collaboration and commitment, as we can see in this press release. EGISAR, we have 5-year strategic framework. Here we try to do knowledge management and communication, update critically important antimicrobial list for human medicine, optimal use of antimicrobial agents in food production through tripartite collaboration, laboratory methods in antimicrobial susceptibility testing, and data integration and surveillance. We have GLASS. I will explain later. And there is also capacity building in low and middle income countries. We organize training workshop, and there are pilot projects like Tricycle project. And in India, we supported this EGISAR project a few years ago, and it was based on Salmonella identification by multiplex PCR, Salmonella antibody antimicrobial susceptibility testing, whole genomic sequencing, and pathogen characterization to begin. And it was decided that we need to expand network of medical and veterinary colleges and human hospital. And the establishment of One Health Institute in Nagpur, it will serve as a platform to expand this kind of collaboration and cooperation between human health and animal health sector. So now global action plan on antimicrobial resistance, we are talking about surveillance. And here we need to understand how resistance develop and spread, including how resistance circulate within and between human and animals through food, water, and the environment that is important for the development of new tool, policies, regulation to counter antimicrobial resistance. So here, basically, we emphasize the need of integrated surveillance, AMR, and we have to generate evidence-based information in country-specific situation. So that's why initially we came with this integrated surveillance antimicrobial resistance. We developed methodology and guideline for integrated surveillance of AMR in 2013. And we have recognized the need of multi-sectoral efforts that can be defined as One Health approach to combat AMR. And it has been developed through a 4-year consultative process, because we have to see whether it is applicable, whether it can be done in resource poor setting. So that's why it took a long time, and it is intended to provide WHO member states with key information on designing a program for integrated surveillance of antimicrobial resistance. And when we talk about integration of surveillance of antibiotic use and antibiotic resistance, as I have already mentioned, that there is a link between antibiotic use and antimicrobial resistance. So here we have to make sure that we have surveillance of antibiotic resistance and antibiotic use in animal, environment, food, and human, so that it can be integrated. And we need to share data and information, what is going on in which area, where there are resistance gene. So all those things we have to work together. And One Health, it is very easy to say, let us work together, but there are challenges because of hierarchy, because of mandate, and because of interpersonal relationship. That we have to keep in mind, but that is the only way to go forward. And we revised the guidance, integrated surveillance of antibiotic resistance in foodborne bacteria. Here we are excluding viral as well as parasitic diseases, only focus on antimicrobial resistance. And here we are not addressing malaria, tuberculosis, or HIV/AIDS, because it is dealt separately. In tuberculosis, there is a vertical program. There is issue of multi-drug resistant, extensively drug resistance, and total drug resistance. These are the challenges in tuberculosis, because we use a lot of antibiotics. And we are addressing those antimicrobial issues which are neglected. And basically it is foodborne pathogen and antibiotics related with animal production. So surveillance of resistance in animal, food, and human, and then surveillance of use in animals and human. We use more, we use irrationally, indiscriminately, then we have AMR problems. So that's why we have to understand and try to bring both data and analysis and reporting together. So that is the way we have to go. And now another strategic objective is optimize the use of antimicrobial medicine in human as well as animal health. And that's why we are talking about critically important antimicrobials for human medicine. So there is a ranking of medical important antimicrobials for risk management and containment of antimicrobial resistance, mainly due to non-therapeutic use or non-human antimicrobial use. It was developed in 2005, and since there are a lot of development, so we update on a regular basis, and latest one was published in 2016. And what is the basis? So we determine critically important, highly important, and important. And there are also criteria, high priority, highest priority, and high priority, and that we have to follow. And we have to see as a holistically. And there are guidance how we determine this medically important or critically important antibacterial, which should be kept for human use. And it should not be used in animal health sector. Now we have a global tricycle surveillance. We have previously we were focusing on salmonella. You may be aware, some of you may be aware, there was global salmonella surveillance, GSS, and we developed. And now we have to find foodborne pathogen which may be present not only in human and animal or food, but also in environment. So that's why we have chosen E. coli, and it is trying to address the concept of One Health, human, animal, and environment interface. So ESBL Ec Tricycle project, we develop protocol and it addresses issues of this simple surveillance across the three main sector: human, food chain, and environment. The food chain also include animals, and then simple microorganism and resistant mechanism as indicator. In that way, we try to see how we can implement in the resource post setting. So there are working packages. Number one is surveillance in humans, hospital, community. So that is the major surveillance areas, and surveillance in food chain, particularly chicken in big local market. And package number 3 is surveillance in the environment, municipal waste, live animal market waste, upstream and downstream water from human waste. And number 4 is molecular biology. Number 5 is epidemiology, and number 6 is antimicrobial uses and resistance. And based on that risk assessment and surveillance, we have to recommend management option, risk management option, that is at country level, regional level, as well as global level. And here we are addressing human, food chain, and environment. So that is the key message. And we are trying to integrate this system. So we have global antimicrobial surveillance system developed by WHO. It is known as WHO GLASS. Similarly, FAO has ATLAS. And then OIE, they are more focused on use of antibiotics in animals. So we are trying to integrate all those data and information so that we can give clear picture what is happening under what circumstances. So it is very, very important to promote multi-sectoral integrated surveillance on AMR using One Health approach. That is important. And that's why we are trying to promote tricycle surveillance project. It has been already launched in Indonesia, and Nepal is in the process, and India is also in the process. So in that way, we want to see integrated surveillance of AMR at the human-animal environment interface using One Health approach. And the key issue at the end of the day is how to make existing antibiotics more effective. So we all have responsible stewardship from each level. So EMR has no single solution because we have to use multidimensional, multidisciplinary approach. We need to work with different sectors, and that is very, very important. For that, we need to ensure political commitment and leadership. In 2016, we organized a meeting on combating EMR, public health challenges and priorities in February 2016 in India, on the request of government of India, because Ministry of Health was trying to ask WHO to provide evidence that how we can deal antimicrobial use and resistance problem in animal health sector. So that's why we invited experts from Sweden, Denmark, Holland, USA, and Japan to explain how they are working for reduction of antimicrobial use in animal production. And so it is very important. Political commitment, leadership is necessary. Stewardship should be there. And we have to educate public about how antibiotics work and how they can help halt the spread of resistance. So now we develop curriculum for school that we are going to have pilot project, because education should start from school. And if we teach about AMR at the school, then these school children, they will convey message to their parents and to their community, and discourage over-the-counter sale of antibiotics. So this is a very, very important issue, and we need political commitment as well as need of this enforcement of regulation, and improve hospital hygiene that is needed from human health side and infection prevention control, because that may be the hub for hospital-acquired infection, and that may be drug-resistant pathogen due to drug-resistant pathogen. And how to dispose those hospital waste, that is also very important issue. Develop diagnostic kit that rule bacterial infection in or out on the spot. So still there are fever of unknown origin. Even today we do not have very effective and very sensitive and specific diagnostic kit for typhoid. Still, we are using century-old technique, and that is a real challenge. And if we can develop those diagnostic kit, that will help us to decide whether to use antibiotic or not. Otherwise, there is therapeutic roundabout. So one antibiotic is used. If fever is not down, then another. So in that way, that is happening, particularly in rural area. And that we have to check. And ban antibiotics as growth enhancer. As I said, now from 2022, there is international pressure on use of antibiotics in animal health sector, and there is also whole genomic sequencing. So we have to take this action sooner or later, and we should not only address this issue for international trade, but also for domestic market, and use more antibiotic vaccination to head off the need for treatment both in livestock and in people. So this is the only way, and biosecurity. So in that way, we can minimize the use of antibiotics. And last but not least, consumer, patient, they should be made aware. Still, I can see in our region, if doctor will not write so many medicine, prescribe so many medicine, or even they will not recommend one injection, they will think it is fake doctor, you see. Good doctor will not recommend half a dozen antibiotics or so many tests, laboratory tests to be conducted. But this is the mindset of our patients as well as consumer that we have to take into account. So it is two-way traffic, human health and animal health sector. They should work together. Blaming each other, that is not going to solve this problem. Thank you.
Thank you, Dr. Gongal, for your nice presentation. And as we know that you are known to give good presentation all the time. So this time also you have given very crisp and informative content to the viewers, and I hope viewers may have some questions. If they have, they can just place it on the chat segment. In the meantime, I just want to know, you mentioned that one example of China, that the veterinary, the patients or the owner of the patient, they don't go to the veterinarian for the medicine prescription. Instead, they go to the retailers to buy the medicine. I think the same situation exists in India and developing countries. So now the question is, even if we give a lot of emphasis on this education and everything, unless the retailers, they are not restricted by law to sell medicine to the buyers, I think it will be difficult to control this particular problem.
Yeah, that's why we have to generate evidence-based information. So when there was Yendium 1, there was a big human cry, and somebody was saying, oh, maybe some countries, they try to damage medical tourism in India. So that is a classical example, and that was the trigger point for India to emphasize on EMR issue. And definitely, we have long way to go, but we have to start from somewhere. And we do not want to name any resistant gene like Yendium, New Delhi or Bangalore or Pune, you see. So that's why we have to educate our industry as well as producer as well as consumer. And consumer has to play important role. And now multinational, this restaurant chain and food supplier, they are trying to follow that commitment, you see. And that's why in India also, they may be trying to get antibiotic-free chicken. So, and they may try to create their own system. Yes, there are issue of food security, and there are issue of economic loss, because if you do not use antibiotic, if you cannot ensure biosecurity and vaccination, definitely we have to use this one. But here the main issue is we should try to restrict the use of medically important antibiotics like cholesterol sulfate. So those kind of things we have to work together. Here, we cannot say that all antibiotics will be banned, but let us focus on medically important antibiotics. And European Union is also saying same thing, that we have to ban medically important antibiotics, because that will cause problem in future, like 2050. So a doctor is helpless in front of patient because the antibiotics is not working. So in that way, we should try to generate evidence-based information. We should try to see how antibiotics is used and what are the challenges. And based on that, we should try to develop policy so that that can be implemented. So it is a big challenge for veterinary community, and research institution like veterinary college has to play important role to fight against antimicrobial resistance problem.
Okay, Dr. Gongal, you are widely traveled man. You have visited so many countries, and you have got a lot of exposure. So you just see the Indian condition is different than the European and the American countries. So in those countries, the patients or owner of the patient, they can't purchase medicine. They can't buy medicine without prescription. So do you think that they have got less problem of this AMR, or what is the situation?
Yeah, so here I want to highlight that definitely there are regulation, there is enforcement, but this antimicrobial resistant gene, they also travel from those countries where it is not regulated to their country. So definitely the way they are trying to use regulatory management and this hospital management practice and prescription auditing. So they are trying to minimize, and that's why they are in better position than us. But they are also not safe, because unless it can be improved in India, China, and in our setting, they are not going to be safe, because people are traveling, and we can carry those kind of resistant gene in Europe, America, or Japan. So that is the major important issue. And in animal production, as you have seen, not all European countries are fine, but they are trying to do, and they are making investment case for production of antibiotic with minimum use of antibiotic use in animal production. And there is an issue of this governance, and in country like Bhutan, Maldives, and DPR Korea, there is no private farm or anything, you see. So they are in better position, even if we see developing countries, but where there is private sector and where there is challenges to coordinate with private sector and big market like India. For India, it will be a big challenge, because India itself is a big market. But India, we have to understand that there are also good practices within India, because India is exporting a lot of aquaculture product, seafood, and chicken. and they will follow that their standard. And if you will check those products, there is not a big problem because they have to follow standards set by importing country. The issue is domestic market. The people who are here, whether they are getting those kind of product or not. Yeah, cost is also another factor. If we do not want to use antibiotics in animal production, the cost will definitely go up, because either we have to take biosecurity measure or vaccination. And another important challenge is poultry farmer, they are small farm holding. So that's why it is a challenge. So we have to find solution considering the Indian context.
Okay. Dr. Vaidya, is there a question from audience side?
Yes, sir. One question is there from Dr. Surendra Karki. He is asking what is the role of substandard drug widely available in developing countries in the emergence of AMR?
Yes, this is basically in human health sector, not in animal health sector. And in human health sector, that's why WHO has created Southeast Asia network of drug regulatory authority. And that we are trying to implement. The major challenge is it is porous border. And for example, these substandard, spurious quality and these falsified products, it is produced in some areas like antimicrobial, this anti-malarial drug. But through this informal channel, that means open border, it is transported. And that is a real challenge. So it is up to the National Drug Regulatory Authority to take that matter into consideration. But basically, this is a real challenge because of this open border system. For example, Sri Lanka may be in better position than those countries which are having land border. So because there is control over the import. And that's why it is not easy task. And substandard products, as well as these quacks, they will give you one antibiotics, latest antibiotics, and fever will go down. And in that way, that is also happening. So it is not only substandard drug, even standard drug, if you use in low dose or you are not using according to the prescription, then that will also contribute to resistance problem. So it is up to drug regulatory authority and cross-border collaboration between the countries. So like India, Nepal, or Bhutan, or Bangladesh. So we are having this kind of problem.
Okay, Dr. Well, I can see the chat segment, and I find that many of the audiences, they are appreciating your presentation. So congratulations and thank you.